then you had some very interesting things to say, and I saw a lot of information come up about medications and a quick fix, take a pill for a pain, things like that. So I just wanted to take just a couple of minutes, and if a few of you want to share your thoughts about what you think the role of modalities are in chronic pain, because we're actually going to work on some of those modalities today. So, any of you have an idea?
Well, my first thought was that it would be to help relieve the pain and muscle guarding that comes with that.
Mm-hmm. Mm-hmm.
Wouldn't it also
So,
be a tool to help educate the patient to manage their pain if it's a chronic?
absolutely. So if you think of the nature of chronic pain, chronic means
Right.
it's long lasting.
Yeah.
So whereas someone comes into therapy with a torn muscle, an ACL injury, a pretty finite injury, we're going to try to get them through the healing process, get their function up, get them back to their normal state of being, their normal functioning. But chronic pain, there's always this up and down, up and down, up and down. So think about physical therapy. Our goal is to actually have goals, to work towards goals and actually get to an end, to actually achieve this normal homeostasis well-being. But with chronic pain, you don't necessarily always get to that. So our modalities, we think about those as helping us through some of those time periods, but with chronic pain patients, they're going to be getting them regularly. So for insurance purposes and for our purposes, we actually want to set goals and reach those goals, but are your chronic pain folks going to actually meet those goals? And then when are we just having them come into the clinic 2-3 days a week just for these modalities over and over again? So anyone have any thoughts about that? Patients coming in wanting the massage and the heat and ultrasound over and over again. Are we actually achieving a goal by having them come in and do things that they can't do at home?
I can see using those modalities to allow them to learn how to build up their muscles or the things that are, not right in their body, and to help them to have that as a goal to be stronger.
Mm-hmm. Absolutely. What were you getting ready to say, Ted?
You're just teaching them some of the modalities that they can use at home
Mm-hmm.
for when they do have the flare-ups, so they don't have to come in.
Right. Right. Very good. Very good. So think about this. Yes, Daniel.
It's temporary pain relief, so in the clinic they can have their pain relief for a short period of time and maybe take that home and do the same thing at home.
Mm-hmm. Do you think?
Exercise post.
Right. Do you think there's maybe a possibility or a tendency to get a little bit dependent on modalities?
Yes.
Mm-hmm. Absolutely. Absolutely. If you give a person a choice between having something nice done to them versus them having to do something, oftentimes this is the route they might want to take. Yes, Ben?
And focusing on modalities in the plural, this really goes down to patient response.
Mm-hmm.
There's no clear cut, okay, this is the answer. With the same conditions, one patient might respond favorably and another might not do anything,
Right.
hence chronic pain. And they might have been doing therapy for years and they've got this chronic pain component that just hasn't been addressed.
Absolutely. So think of this as just one of your tricks in your bag to help educate patients, to help make them feel better, to help them help themselves feel better, that it's just a short-term, temporary part of what we do. And think about that through the day as we go through the electrical stimulation modalities. How can this be used? Is this only something that can be used in the clinic? Is this something that a patient can take home and use? Is this something, bless you, is this something that's just going to be for a short time, or is this a modality that someone might get addicted to and want to keep coming in? So think about that through the day, and then we'll revisit that. And after you've actually had a chance to feel all of these and see how they're used and see them in case scenario situations, see what you think. See if that changes your idea at all. So most of you see a different face. I was going to say strange, but Joe's not strange by any means. No way. So back here is Joe. I'm going to have him come up and introduce himself and tell you what he actually does. Some of you actually already know him or have worked with him in some manner. And if you are a physical therapist assistant in this area, you will probably see Joe fairly regularly. So,
Or not. You have a pretty wide area, don't you?
So come on up, Joe, and for Joe's purposes, I had all of you put a tape name tag on, so you know his name and he can actually know yours too. So, go ahead, Joe.
I can't read those. There's a huge placards in front of you.
You
You
want
can
my
see that.
glasses?
No, that's all right. My glasses are just for reading, so I don't need them right this second. But yeah, my name is Joe. The company I've been working for 15 years is called Paratech. We actually do cover all the Northwest, and so I have gotten to know some people over the years. We are basically an equipment provider. We don't just do that. We do lots of servicing and whatnot. I don't want to spend a lot of time talking about Theratech, because that sounds more like a pitch for my services, but just to understand my role in the community, in the workplace, in your workplace, is to not only provide equipment, like a lot of the equipment in there has come from me. We pretty much do handle it all, so I'm very familiar with pretty much everything that you'd use in a given facility. You know, certainly with modalities, they tend to be the hottest item that I sell, from ultrasound and STEM and cold laser and biofeedback and some other things. So again, I'm not a PT. I play one on TV.
But she's a member of our club nonetheless.
Yes, but I'm a member of the club. A member of the club, definitely, and enjoy it. I do walk a fine line sometimes because people do think of me that way, because doing in-services, doing training on how to use the equipment, I am fielding all kinds of protocol questions, and I'll do the research for people and all that. So, have I learned a lot over the 15 years? Absolutely. But I am still a liaison, as it were, between the manufacturer and the therapist and sometimes the patient. I have oftentimes, many times, been standing there with the patient and the therapist, even being solicited to get involved with the modality application. I resist, only because I'm not allowed to touch the patient. But nonetheless, I will give my best guidance to the extent that I understand it. A lot of times the way I do it is I explain to people, especially when I'm doing a training, people say, well, what are people doing about muscle spasm? What are they doing? Why are they using ultrasound still? Why are they using cold laser? You know, what's going on with that? Well, you know, I can tell you what the manufacturer says. I can tell you what the guy around the corner is doing it, what his rationale or her rationale is for doing it. But again, I try to keep one step removed from endorsing one particular protocol over another. Again, that being said, I have facilitated many a workshop on modalities. In fact, I believe one of the textbooks you're using, Michelle Cameron's
Yep.
book?
Mm-hmm.
Yeah. So Michelle Cameron, you guys know who she is? You've seen her name on the textbook. Yeah, so Michelle's somebody is an example, wonderful educator, does a lot of these modality instructions. In fact, she is currently in residency at OHSU. And so she's been wonderful to have in the Northwest. So chances are you probably even meet her in the future if you continue on in this field. But again, my point is in that connection, so again, I feel like I've learned a lot from her as well. So it's okay to lean on me for some kind of instructional guidance, just understanding that I am not to be matched with these two standing over here. Again, but I am certainly very enthusiastic about the role of modalities, and I've seen it not only as a professional, but for myself. You know, as Beth Ann began to indicate, I mean, and you guys are going to continue to explore, there's certainly a passive nature to it, but you don't want to stay on that passive route too long, because the tools can also be an educational tool. I mean, you really can teach people with these tools that can be passive, but again, hopefully can get them active, and you can play a role in teaching them something. And as we'll discuss more, especially with STEM, sometimes you're trying to mimic what they can do on their own, but in the meantime, they don't understand, so there could be a cognitive gap in addition to real pain or discomfort or poor biomechanics, whatever it is. So again, I do